Hi, everybody. So, throughout my practicum, I got a lot of experience with patients who had sickle cell disease. They were admitted due to their pain management. They had already had their diagnosis for quite some time, so I never got to see the child life specialist really explain sickle cell disease. So, I figured I would take that information and use it to come up with a teaching activity with loose parts. So, what you need is a straw. Preferably clear because you can see what's going on, and the straw represents blood vessels. And then I used red Play-Doh. Luckily, I had red Play-Doh to represent the cells. You could also use beads. In my family, my mom is a big beader. So we happen to have a lot of beads, which I'll show you. And she even has some crescent-shaped beads, which is pretty perfect. But I thought with Play-Doh, it incorporated a bit more sensory. So what you can do is you can explain to the patient that sickle cell happens when your normal red blood cells, which are shaped like round discs, and they're pretty squishy, bend and turn into the shape of a sickle, kind of like a crescent moon. So you can go about building these little red blood cells, teeny tiny, because I have a teeny tiny straw. You could use a bigger piece of tubing, and you could make them bigger and bigger. And then you can have them build some sickle cells. I don't want this video to take forever, so I pre-made some. You can either have them pre-made or you can make them with the patient, super sensory, if they're playing and bending and rolling Play-Doh and whatnot. Another way you can do this is because the normal red blood cells are squishy and the sickle cells are hard, you can let the Play-Doh dry. So it's hard, but I don't know how long that takes, so I haven't done that for this. And then what you can do is you can explain to the patient that this is your blood vessel, and with the blood vessel, your blood travels through it, and that's how oxygen's carried to your body. And normal red blood cells just go straight through, and you can keep doing as many as you want and just show them that normal red blood cells go straight through the blood vessel. I'll do one even closer in case you can't see. See, it goes straight through. And then sickle cells, on the other hand, get stuck. And you can take these sickle cells and you can put them in the tubing and show them how they don't move. They just keep getting stuck, and that's what causes the pain because the oxygen can't get carried throughout your body. And you can keep pushing them in, and they just stay there. They get stuck, and that is what happens with sickle cell. So I thought this was a great teaching opportunity to use with patients. I tried getting the Play-Doh out. It's pretty hard, so once you use a straw, it's done with. And then you can even attempt to push a normal blood cell in and show them that then that normal blood cell can't get through and the oxygen's stuck. So that was my teaching and loose parts, and I'll just show you guys more of my sickles up close versus my regular round. So that's how I did it. Hope you enjoyed it, and I'm looking forward to seeing everybody else's.